Well, good morning, everyone. This is David Boudet from Miller Johnson. I hope everyone is doing well today. Today is a great day. You do not have to listen to a lawyer speak to you very much. Instead, we have someone that actually knows something about COVID-19 and how to handle it and how to make our workplaces safe and someplace that we feel comfortable returning to. His name is Dr. Richard Van Enck. He's the Director of Infection, Prevention and Epidemiology at Bronson Healthcare System. He has graciously agreed to give us his time today, and we have some questions for him that we have taken from the questions we've received from our clients over these last several weeks, and I think he'll provide us some excellent insight. Before we get to those questions, however, as always, we start out with the last 24 look back 24 hours and see what's happened around the world as it relates to COVID-19, and have, again, a few items to share with you. Some European nations are beginning to ease the pandemic restrictions. This signals a slow global movement towards trying to restart economies. So that's obviously a shift going in a positive direction. You see some political movement in our country, or our state, I should say, pushing back at the governor, suggesting maybe we should do the same thing. We have over a quarter of the Michigan's workforce is filed for unemployment. We have 80 million Americans are expected to receive their $1,200 payment on Wednesday, April 15th. Yesterday, the president announced that the United States will halt World Health Organization's funding over the handling of the coronavirus outbreak. And then there is some reports that Michigan may show some early signs of plateauing and the growth of confirmed cases. Additionally, which is really cool, Beaumont Hospital, the state's largest hospital system, has launched the country's largest testing study for COVID-19 antibodies, which will take this into a new phase of information, which hopefully will be helpful. After that update, I'm going to now turn over to the questions we have here for Dr. Van Enck. First, again, welcome, Dr. Van Enck. Appreciate you taking your time today. First, I'll just start off with a very general question. In the workplace, what presents, from your perspective, the greatest risk of transmission of the COVID-19 virus?
Yeah, that's a good question. It's one that I think a lot of people have misconceptions of, and the misconception that people have is that it's mainly through the air. And that is actually not true. We call it a droplet in contact spread infectious disease, and that means something very specific. It means that the virus is a respiratory virus, but it gets into your body through your mouth, your nose, and your eyes. And the typical way that it does that is touching your face. So the way we describe it in infectious diseases is that your face has a T on it. Your two eyes and your nose and your mouth are sort of like the capital letter T. And if you can keep your fingers away from that, then you will not get COVID. And so I think there's a misperception that if you walk through, the air cloud that somebody has just breathed, you're going to get it. And that isn't really true. It's mainly by touching things that are contaminated with the virus that someone infected has touched, and then you touch your face. So that's the primary way that the virus is transmitted. And if you can prevent that, if you can, with barriers and things, then you can reduce the risk of infection by a great deal.
Thank you. The CDC has put forth some recommended steps and things that employers should do, guidances, best practices, whatever you want to call them. They include good hygiene, wearing masks, social distancing, personal health assessments, taking temperatures, cleaning and disinfecting. And many of the folks on the call are very familiar with these and have implemented those in their workplace. But just from your perspective, can you comment on those guidance, those steps that the CDC has recommended? And if you can, and maybe this isn't a fair question, kind of prioritize them. Tell employers, hey, from my perspective as an expert in this field, this is what I think probably is where you could focus most, or maybe they're all equally important. But that's kind of what I'd like you to respond to.
Sure. I would put these in kind of a priority order, and some of them are related to each other, but I would say A and F are probably very good. That is, encourage and enforce good hand hygiene practices, because if nobody has COVID on their hands, then they're very unlikely to contaminate the environment where other people are. And then cleaning and disinfection of high-touch surfaces, and you define those for your own business. Doing that regularly, I think in the past we would do it at the end of the business day, but now we probably have to do it more often than that. That would remove any of the viruses on those surfaces that might be sources of transmission. After that, I like social distancing. It's known that if you stay at least 6 feet away from someone, and no matter how loudly they talk or how frequently they cough or sneeze, you're not likely to get their droplets on you, and so social distancing is good. So that might involve rearranging like waiting rooms or cubicles or something to maintain a 6-foot distance between people. And that's very, very, very helpful. After that, they're kind of related again. The hand hygiene and the wearing of the masks are related because the mask covers your nose and your mouth, and so it reduces the ability of your hands to contaminate yourself. So that's good. The last two, doing health assessments and measuring employees' temperatures, probably they're good things to do, and we probably should do them. But at that point, it's probably too late. You've already got a shedding person in your building by the time they feel sick and they take their temperature. So it's sort of like a little bit late. It's good to do, and we should do it. We certainly shouldn't have sick people working, but by the time they feel sick, they've probably already been shedding the virus. So that's how I would prioritize those 7 items or 6 items.
That's very helpful. We got a question in that someone asked, and they said that this may be a dumb question, but I don't think so, because you explained the T. And they said, well, does the T include the ears? So people pick at their ears sometimes. Is that part of the T?
No, it's not. Your eyes, your nose, and your mouth are all connected inside your face, and so that's all basically one respiratory system. But your ears, because you have an eardrum there, they're not directly connected with your respiratory tract, so you can't get COVID from touching your ears.
Okay. I'm now going to kind of direct your attention. Last week, I think it was last Thursday, the CDC issued some new guidance for critical infrastructure workers, which I'm sure you're aware of, are those folks in our country that are continuing to work because they're part of a business that is critical to, we believe, our ongoing lives. And so unlike others who are at home, they're compelled to go to work, including healthcare workers that I'm sure you're very familiar with. And what the guidance said, first of all, it said that potential exposure be someone who has been in a household member and they've had close contact within that individual, or confirmed or suspect with someone who has it or someone who's suspected to have COVID-19. And even though they've had that exposure, they believe the employee can still nonetheless come to work. So if my wife, if I'm an essential worker, has COVID-19, I'm asymptomatic, the CDC says, yes, David Boudet, you can come to work. And then they list the guidances of what should be done, which are many of the same things that I just listed above to you. And I want to know your reaction to that shift from prior to that. We'd been telling clients based on CDC guidance that if you had been exposed, if your employer had been exposed to someone who was COVID-19 positive, that individual, that employee should not return to the workplace, even if they are asymptomatic. But now we're seeing CDC tell us, no, it's okay to have them return to work. So there's a differing, obviously, some shift in the opinions there, and it's caused a little bit of confusion and discussion on our end. So if you could comment on that, it'd be helpful.
Absolutely. Yeah. This is a shift that occurred in healthcare probably 3 weeks ago. And so initially the idea was that if you had any potential exposure to any possible COVID patient, you needed to be off work. And then the data don't really support that, and it was devastating to the healthcare sector, because you had lots and lots of people sitting at home not working for no good reason. And so the CDC actually changed and said, if you don't have symptoms, you can come to work and you should come to work, but you need to wear a mask. And so that brings us back to that mask idea. The mask is very important and very effective. So if you are shedding virus, the mask will protect other people. And if you're not shedding virus and somebody else is, the mask will protect you from them. So our guidelines now for healthcare is that you can come to work if you're not showing symptoms of a respiratory illness, but you need to wear a mask while you're at work. And so that's our strategy, and it has worked well. We have not had outbreaks in healthcare workers because of this, and so I think it's been effective, and it's a better stewardship of our resource, because you don't want your good employees sitting at home for no reason.
Okay. And when you say wear a mask, I mean, the term mask gets used broadly. We know in healthcare there's certain types of mask, and then there's a bandana you wrap around your face. Obviously, for employers that are not in the healthcare industry, they don't have N55, N95 mask, whatever they're called. They don't have those for the most part. So when you use the term mask, what are you referring to, Doctor?
We have different types of respiratory protection, and one of them is the one you cited there, the N95, which is also used in industrial settings. That's kind of like the highest level. You don't need that level. We call it a personal mask or a cloth mask. So we have lots of them. You can buy them. People make them. Cotton is a good material, so it's any fabric that will cover your nose and your mouth and is comfortable to wear is adequate for that purpose. So we don't buy some sort of fancy medical grade masks for that purpose. All of our employees, when they're in the building, wear a personal mask or a cloth mask, and that catches those secretions and prevents you from touching your nose and your mouth, and it fulfills the purpose. And we have lots of them, and we use them all the time.
Very helpful. You talked about this already, the importance of cleaning, but we get many questions about COVID-19 and how long it lives on surfaces, and whether it's on paper because it's boxes from things that we empty from a truck, or we get it through deliveries, whether it's on a piece of metal equipment, whether it's on a door handle, whether it's in the bathroom, whether it's in a break room. So I don't know if there's different, I list all those things because that's the kind of questions we get. Is there a difference on the types of surfaces it lives on? How long does it live? How often should we disinfect? But if you could discuss those types of issues, I think that would be helpful to folks.
Yeah. It's a good question. It gets a little bit technical to answer that question, and so I'm gonna be a virologist now, and I'm gonna use language that you might not use. I'm gonna reframe the question. That's something that attorneys do a lot, right?
So you can't do that.
I've learned from attorneys how to reframe the question. The question, how long does it stay alive, is the wrong question. I think a better question is, how long is it infectious? Yep. Or how long is it capable of causing an infection? That's really a very different question. For one thing, viruses aren't really alive. We call them non-living. They don't live on surfaces. They don't replicate or metabolize or anything. So they persist, but they're not really alive. And the other thing is, when you excrete a virus from your body, you excrete thousands of them or, hundreds of thousands of them, and they start to die immediately. That is, they become sort of non-viable, or they stop being infectious almost immediately. So the way we describe viral existence outside the body, the host, is half-life. So some of you remember back in college or whatever, you took a science course and different things had a half-life. That is the time it takes for half of something to go away or to be, no longer effective. And the half-life of the virus outside the body is more like about an hour. And so after an hour, half of them are dead. And after another hour, another half of those are dead. And so they're dying constantly at a constant rate once they leave the body. So the question is, how long before something is unsafe to touch? And that's a matter of hours. It's not a matter of days. The question of when is the very, very, very last virus, incapable of functioning, that could be days. But who cares about that last, virus that's hanging on a particular surface? If it's not going to cause an infection, do you really care about that? So think of virus death, as you will, as a curve rather than, as they all stay alive for a certain period of time and then they all die at one time. You're following a curve down towards zero. And at some point during that curve, they no longer can cause an infection, and then something is safe. And that's a matter of hours. It's not a matter of days or anything like that. Another thing about the virus is that they're really easy to kill. Sunlight kills them, drying kills them, any soap, any detergent, alcohol kills them in seconds, So it's different viruses have different capabilities of surviving, and this is one that is not designed to persist outside the body for a long time, and so it's easy to kill. And any simple disinfection or cleaning is going to get rid of it.
So, Dr. Van Enck, I like to have a cocktail at the end of the evening, so you're telling me that is good for my health then, right?
The alcohol in there will definitely kill the virus, yes.
Good. Hey, I did get a serious question about this. We have some folks that work at a credit union, and so they're handling a lot of currency. They call it Munty. The employees go, I got this money dust. It's coming at me. It's got the virus on it. It's unsafe. What's your response to that?
I would say if somebody took something out of their pocket and put it in their hand and handed it to you, yes, that's contaminated. But within hours, it's starting to die, and the the danger of that is declining over time. So we consider money to be dirty or contaminated, and when we handle money, we wash our hands before we touch something else. And, the biggest example of that is our coffee shop. And so there's two processes. One is the financial transaction where you give the money to the person and they open the cash register. Then they turn around and wash their hands and they make your coffee. And so if you can separate those two processes by hand hygiene, then you've established safety in your business. And if your job is to handle money all day long, then you should consider that to be a potentially contaminating process, and you should wash your hands before you eat your lunch or something like that.
Okay. The next question that I have for you is, we have workplaces now where folks are returning. Some folks who had tested positive for COVID-19 and have now been released to return to work. And so we have clients and employers asking us, what does that mean? Does that person present a greater risk because he or she had been tested positive for COVID-19? How do we know that's safe? How do we educate? Should we be concerned? Those are the types of general questions that we get, and I'd like you to comment on that if you can, please. Yeah,
we do have some guidance from the CDC, and that's the best that we have. there's probably primary literature that's being published now on different aspects of that. That is, how long is somebody shedding the virus, or how long are they contagious? But the best guidance that we have from the CDC is that your transmissibility, or your ability to transmit the infection to somebody else, closely tracks your symptoms, and particularly your fever. And so if a person, their temperature is normal for 72 hours and all their other symptoms are baseline, whatever that is cough and shortness of breath, if those are at your baseline, because some people are always short of breath, right? If you're not in good shape, you go up the stairs, you're short of breath. But so don't ask if somebody's short of breath. Ask, are you at your baseline? And so if you have no fever and all of your other respiratory function is the way it was, when you were healthy, for 72 hours without being on any sort of anti-fever drugs, Tylenol or Motrin or aspirin, then the CDC considers you to be not transmissible and safe to come out of isolation and interact with people the way you normally would, and you're safe to go back to work. So that's the answer we are getting from the CDC, and that is what we're using in the hospital.
So I'm going to summarize. So if a healthcare professional is releasing David Boudet to return to work, he's asked me, or she's asked me, all of those questions, and if I've checked all the right boxes, me as an employer should feel good. The doctor asked the right questions, or the nurse practitioner, or the whatever, and we should feel comfortable that that person has met the standards you just discussed and is safe to return to work. Is that fair to say?
That's correct.
Okay. And are you aware, since we have been people returning, have you heard reports, or are you familiar with reports that we've had some flare-ups because, David he's still transmitting, even though we thought he was good. We're getting a spread because David's returned from having his COVID-19 positive experience. Have you had any concerns like that in West Michigan or anything like that we should be aware of?
That's always a concern, but we have not seen situations like that where we've had somebody have a recurrence of their infection once they recover, and the milder the infection, the faster the recovery. Most people that have mild to moderate symptoms recover completely in about 10 days. Okay. And the more severe patients, of course, it takes longer. If you end up in the ICU, you're not going to be back to your baseline for a month or more. And so for those people, they're going to be home for a while because they're not going to be back to their baseline. But if somebody had a mild infection and they're completely cured, and no signs or symptoms for 72 hours, we consider them safe to re-enter.
That's an interesting point that you just brought up, and I want to go back to it because we always talk about COVID-19 cases as if they're all the same. If one person gets it, it's the same in David Boudet as it is in Dr. Van Enck, as it is in Joe Smith. And you just made a point, I think that's a good point, and that is we all have different reactions to this virus, from something that you just said was, would you say, could be within 10 days you're fully recovered, to other folks that could take more than a month. Did I hear you correctly?
Oh, yeah, at least, yeah.
So when you break down percentages, what can we expect in the general population when they look at the data? Are most of us going to be the 30-day experiences that you're talking about, or is it more the 10 or the less day type experience for most of us?
Yeah, we have data from China, and they, of course, have had the first cases and more cases than anybody else. We're still in the middle of the outbreaks, in Europe and the U.S., but we're learning a lot. We're kind of in the middle of it, and so those data will be available for the U.S. But there are some simple numbers that are being used to describe the situation in China, and that is 80% of the people who have any COVID disease at all have mild to moderate disease. and it can easily be managed at home. You don't need any hospitalization, no oxygen or anything like that. It's just kind of a nasty cough and a fever, and the fever tends to be intermittent. That is, one person said that it goes down in the morning and it goes up every afternoon. So it's not necessarily a consistent, steady fever, but it's kind of on a daily cycle. So you'll have that. And you'll pretty much get over that in 7 to 10 days. 15% of the people need a little more help. They need their lungs have a little more damage, and they need some oxygen. And so they will end up in the hospital, but just on a general medical unit. They don't need intensive care or anything like that. And only 5% of the people actually require critical care type interventions. That is, the lungs are so damaged that they need to be on a ventilator. So the vast majority of people have mild to moderate disease, and then somewhere around 20% require hospitalization and so on. The one unknown, which we're starting to get some data on now, is how much completely asymptomatic COVID infection is there. Sure. And we don't know the answer to that because we don't have an antibody test yet. An antibody test tests your blood for antibody to the virus, which means you had it. And so when that test comes out, and that's one of the tests that Beaumont is right. going to do, they got a grant to do that, and so they're going to test all their healthcare workers, and they're going to find out how many people actually had COVID and mounted an immune response to it and never had any symptoms. And we think that might be as much as 50%. So if you look at the total number of people that got sick, you can double that number, and those would be people that never got sick. And those might be younger people. They feel fine, or, they don't complain of any symptoms, and they actually had it. So we're just filling in all the pieces to the puzzle of COVID now, and we should have, better data as time goes on.
Good. And that leads me to a question that a couple of people have emailed me here right now, and that is, if someone has had COVID-19, are they then that individual considered to be immune from getting COVID-19 again?
We think so. The reason I have to say we think so, and some people would say we don't know, but I don't think that's completely true, because we know a lot about COVID and we know a lot about viruses like COVID. And normally, after you've had an infectious disease, you have immunity to it for some period of time. And we have no reason to believe that COVID is different than that. We think it behaves just like any other virus. And so after you've had it, your body will make an immune response to that, which should protect you for a while. And other viruses, the ones that are most closely related to COVID, it's called SARS. I don't know if anybody remembers SARS from several years ago. It looks like that immunity lasted, in the area of 2 to 5 years. So it's probably unlikely that someone will get COVID twice, at least not, in the same season. They might get it 10 years later or something. The other thing about the virus is that it's not mutating very much. Some viruses like influenza mutate quickly, and that's why we have to get a new flu shot every year. COVID is not doing that. It is not mutating. So the virus that we have right now in Michigan is very, very similar to the virus from China in January. So if the virus isn't mutating and our immune response works, we should be protected for a while.
Right. I'm going to, again, turn a question here to the people coming, because I think this is a common question and a good pickup by someone. When we're asking people on the front end now, Doctor, we have more employers asking employees as they enter the workplace to do a health assessment. Do you have a temperature? Do you have any of the COVID symptoms? Well, one of the COVID symptoms, as you mentioned, was the respiratory issues. And in Michigan, many of us, unfortunately, suffer from seasonal allergies. And so even though my baseline on a normal day is not to be congested. I certainly, when the pollen comes out, so to speak, I know I'm congested and I'm feeling obviously my respiratory system's not as good. So we're getting some of those. So how do we distinguish between someone that's an allergy that says, hey, I think that's what it is, as opposed to a COVID symptom that's respiratory? What's the types of follow-up questions you recommend our employers ask, or how they should feel comfortable in those scenarios?
Yeah, that gets a little bit into kind of a medical assessment, but there's a big difference between an upper respiratory tract infection and a lower tract infection or a pneumonia, an infection of the lungs. COVID causes pneumonia. So it's a dry cough that the person has. It's not a runny nose. It's not, swollen eyes and itchy eyes, and it's not a sinus infection. So it doesn't infect the upper respiratory tract in your head. It affects the lungs. And so there's a small number of people who apparently report a little bit of a sore throat, but that's quite uncommon, actually, and it's not characteristic of COVID. So I would say anything above the neck is probably your seasonal allergies or a cold. But if you have a fever and shortness of breath, and you really have a hard time getting air into your lungs, that's what COVID looks like. Okay. It doesn't look or feel like allergies, and most people who have allergies have had them for a while, and they know what that feels like. I have allergies, so I know when I'm having an allergic attack, and that is not what COVID looks like.
Very helpful. And then one more question that came regarding the cleaning areas, because you brought up the cleaning and the importance of it. And one of the things that was mentioned is you see more companies advertising that they'll come out and do a deep clean. I think they call it fogging. And no one's trying to knock those, that idea of that more intense cleaning. But is that necessary, or is just a good cleaning, the wiping down with soap and water and disinfectant of the door handles and the surfaces and all of that, is that sufficient? Or should we be fogging our entire buildings when we have cases in our manufacturing facilities or our banks or our credit unions? So that's
Yep. It's kind of a belt and suspenders approach, okay? So you do your normal wiping of your high-touch surfaces. That's normally adequate if you do a good job, and if the person leaves the cleaner or the disinfectant on the surface for the correct amount of time. So we call it the wet time, or the application time, and it takes time for the disinfectant to work. As I said, the viruses die along a curve, and it's not immediate. It takes time. And so, some of our disinfectants in the hospital have a 2-minute contact time, or 3 minutes, or 4 minutes, or even 10 minutes. And if it's not in contact wet for that amount of time, then you didn't do a good job. And so a lot of people are saying, well, we did the regular wipe down of the surfaces, but we don't know if we got them all, and we don't know for sure whether we did it correctly. So let's do an additional safety step. And in the hospital, we often use a technology called ultraviolet light, and we call it a robot, and you put this ultraviolet light emitter in the middle of the room, and that zaps the room, and it doesn't replace cleaning, but it supplements it. And so I would call the fogging or the ultraviolet treatment a supplementary thing. It doesn't replace good cleaning, but it if you missed a little spot, it might catch those. So that's what I would describe that technology as.
All right. After you've cleaned and fogged, assume that took 12 hours to do for a facility. Once that completed, is there a need to stay out of the facility for another 24 hours or 36 hours, or once the cleaning and fogging is done, should it be safe at that particular point in time?
Well, we go right into the room as soon as that process is done. I don't know what the vapor is that's being used for some of these facilities, but if the vapor is not toxic, as soon as it leaves the air, depending on the air changes, it should be safe to go in.
Okay, good. I'm going to try to. I know I told you I'd keep you no longer than 40, 45 minutes, but I'm a lawyer and I like to talk. So I'm trying to keep this. You're doing great.
And you get paid by the hour too.
I do. I get paid by the hour. And I got 4 kids that are hungry. Anyway, we've read a lot of numbers about COVID-19. I'm sure you're familiar with them, and we all want to know your expert opinion as where are we in West Michigan? I'll emphasize the word West Michigan in relationship to hitting our peak. We read about the peak, and is it coming? Are we there? Is it a month away, 2 months away? And I know no one knows for sure, but my guess is you have a better idea than most of us on this phone call. And so your observations of that would, I think, be helpful.
Yeah, that's the big question that everybody wants answers to in my business, and none of us have a crystal ball. We do know that when an infectious disease passes through a population that's highly susceptible, like we have now, none of us have ever seen this virus. It normally goes through in kind of a wave or a surge or a peak or whatever you want to call it, and there's not a lot you can do about that, except you can change some things. And the biggest thing that we've done is the social distancing. The keeping people 6 feet from each other, the stay-at-home sort of thing. That has really reduced the peak or the number of potential transmissions of the virus. For the virus to be successful and to sustain itself, it needs susceptible people like all of us, and it needs to have a contagious virus, which COVID is, and it needs some sort of interaction between those people to allow that transmission. So if you increase, the number of people who are immune to the virus, you can reduce the peak. If you reduce the social interactions, you can reduce the peak. Or if you reduce the contagiousness of the virus, you can reduce the peak. And so we've taken the strategy of reducing the potential interactions between people that could cause the virus to spread, and thereby lower the curve. And so we won't have as many cases as we would have if we were all, touching each other and talking and coughing on each other and all that sort of thing. So we think that the curve will be long and low in West Michigan because we started our social distancing well before the virus entered our community. Detroit was too late. They did it too late. The virus had already spread through the community, and then they did social distancing. So then you just have sick people social distancing. That doesn't help. It was too late. And so West Michigan, we were about at the right time to prevent it. So what we think is that the COVID season in Detroit was very high and fast, and in West Michigan it will probably be lower and slower. So we might be dealing with COVID all summer long in Michigan, but at a much lower level than what we saw in Detroit. And that's our hope, because if you can keep the incidence down to a reasonable level, then you don't run out of things. And you don't have, altered standards of care, and your ICUs are not full, and you're not burning up your doctors and nurses and so on. So if we can keep it to a low level, we can manage that.
You said long and low, so I think what you're saying is the same relative numbers will likely occur in West Michigan. We're, instead of getting them in a month time period, we're going to get them over 6 months or whatever the time period is, right?
Yep.
The steps that we've taken, social distancing, didn't make the virus go away, correct?
Right.
So the virus is still here, but these measures, so the social distancing, the good workplace practices we've been talking about, if we keep those in line, we should be able to make this a disease that's much more manageable for our communities and less harsh, I hope, correct?
That's right. That's right.
Okay, good. I'm going to end. I could ask you questions all morning. This has just been fantastic. But I have one last question for you, because I know this. We talked to lots of folks in West Michigan, and we're all very proud members of our various communities. And we think our healthcare organizations up and down the west side of the state are fantastic, and folks like you that work in it are our friends and our neighbors, and we are so appreciative of the work that you folks are doing and being on the front line and keeping us safe and managing all this. And I hear that time and time again. But what they ask me is, and I don't have good answers to this one, is they say, David, what can we do to help? How do we show our appreciation? What can we do to let our healthcare organizations, our healthcare workers, is there anything that's going on that we can do? And so you're with Bronson. I know Bronson's working with other healthcare systems in West Michigan. What can we do as individuals or as organizations to do our part and to support you folks in this very important work you're doing?
Yeah, that's a good question. We feel well supported from our communities, and I'll give you an example. One of the things is these masks. We talked about those 3 times now today, and most of those are donated. We haven't bought a single one. And some of them are really attractive. And so some of our people who like to make things either, with fabric or with 3D printers and so on, have really taken this on and have said, hey, I can do this. I have this skill and this equipment. Would you like some? And so we have had a lot of people step up and contribute things to the healthcare system. So right there, that shows we have some community spirit and some concern for it and desire to participate. I guess in terms of short term, do what you're told to do. That is, cooperate with whatever the interventions that the public health experts in Lansing are telling us to do. They really do know what they're doing. They really do, and it really works. And so I know we have a lot of, or not a lot of, but we have some people in the state that are trying to advocate for different strategies, and it's like the virus is going to do what it wants to do, and regardless of your interests and so on. And so we have to let the virus dictate the strategy for reopening the economy and so on. So do what the experts are telling us to do. And then in terms of longer term, we really need a good public health system. And so that's something that we can think about every time there's an election, because public health basically is done at the county level and at the state level, and we've had a long period of disinvestment in public health in Michigan and many other states, and now that's hurting us. We are paying the price for that now, so we can turn that around and start to invest in public health again, and we can make it safer here in Michigan and in our communities.
Okay, that's it. I did get it done in 43 minutes. That's pretty good. And again, I appreciate it very much. I know everyone on the phone call does, and keep up the great work. And I appreciate you keeping us safe, Doctor.
Thank you.
Okay, see you. Bye.